Clapperboard. Welcome to Psychology and Mental Health. In today's episode, we delve into a pressing issue, the adolescent mental health crisis. Recent research indicates that failing to address mental health issues during adolescence can carry over into adulthood, compromising both physical and mental health and limiting opportunities for fulfilling lives. World Health Organization, WHO. But what contributes to this crisis? One significant factor is the emotional fragility of adults. When adults project their own insecurities onto young people, it can hinder the development of authentic relationships and support networks. This lack of authentic connection often leads adolescents to seek guidance elsewhere, sometimes in less supportive environments. Welcome to Psychology and Mental Health. Today we will explore a crucial topic: how adult fragility affects the adolescent crisis. Brain-adult fragility, an obstacle for adolescence. Many adults today exhibit emotional fragility that hinders the development of authentic relationships with adolescents. Instead of offering support, they often attempt to control young people, imposing expectations without providing concrete hopes for the future. Books. Be Yourself My Way, a contradictory message. Adults ask young people to be authentic, but only according to their own expectations. This approach can create confusion and distress in youth, who feel compelled to meet imposed standards rather than being accepted for who they are. Globe-seeking references on the web. Due to the lack of authentic adult figures, many adolescents seek points of reference on the web. At least 2 out of 3 do not find adequate support at home or school, turning to the internet in search of understanding and connection. Hammer and wrench. Building authentic relationships. The role of adults. To help adolescents, it is essential for adults to develop awareness of their own fragilities and strive to build relationships based on listening and empathy. The key is to offer genuine emotional support, avoiding projecting their insecurities onto young people. Checkmark. Conclusion and call to action. Adolescence is not just a phase of life. It often reflects the emotional and psychological difficulties of the adult world. If we want to improve the mental health of young people, adults must take responsibility for their own emotional maturity and offer authentic and ongoing support. Adolescents do not need to be observed from afar. They need to be seen, heard, and included in ways that matter. They need spaces, like schools and communities, that admit mistakes, foster learning, and prioritize their psychological well-being. Giving them a token presence at meetings or public decisions is not enough. What they really need is real responsibility, real involvement, and trust. As adults, in every role we play, whether as parents, educators, or leaders, we need to reach out and say, "This world is complicated, but we're here to give you the tools and guidance to shape your future." Because, let's face it, future generations are unlikely to do any more harm to the planet and humanity than we have already done. So let's give them the tools to do better, with awareness, compassion, and mental resilience. Bell. Subscribe to the Psychology and Mental Health channel to delve deeper into these topics and contribute to building a more aware and empathetic society.